When I started as a hospital administrator, LGBT health was not discussed. It was just one of those things that, like a lot of issues, was left in the dark. So I was very, very sheltered from the reality of what was going on around me. I just didn't know it. Early in the AIDS epidemic, I remember a very close friend of mine died from AIDS, and I saw the difficulties and the challenges he had in trying to work with a healthcare system that didn't really know what to do.
It's a sad reality, but LGBT people still face discrimination in healthcare. A study by Lambda Legal in 2010 reported that 56% of lesbian, gay, bisexual patients and 70% of transgender patients experience some form of discrimination. These patients report being refused healthcare, blamed for their health status, subjected to abusive treatment or harsh language, and sometimes physical abuse. The fear of discrimination or discrimination itself lead LGBT people to avoid seeking healthcare, and as a result, healthcare disparities are rampant in the LGBT community.
But change is coming. Joint Commission standards and Health and Human Services Department regulations now address the right of LGBT patients to health care free from discrimination.
It's our responsibility as healthcare providers to step up and provide a safe environment for every patient, no matter what their history, ethnicity, or orientation. So a few years ago, we did something very simple. We added a question to our patient satisfaction surveys, and the question was, were your needs met as an LGBT patient? It was a simple question, but it had a ripple effect far beyond anything I could have ever imagined.
The Human Rights Campaign Foundation's Healthcare Equality Index is a self-evaluative tool that healthcare administrators can use to make sure that their policies are LGBT inclusive. Each year, respondents provide a gold standard by which other healthcare administrators can model their policies. Survey and questions include patient non-discrimination policies, hospital visitation, cultural competency training, and employment policies.
It's really important for UCSF to participate in the HEI because it really sends a statement to our employees and our patients that we value treating every patient the same. We believe in inclusion. The steps to be a leader in this area are not hard. They're simple. But more importantly, they're just basic. They're basic family values. They're basic human values. When we take on an issue like this in the teaching hospitals and the medical schools across the country, and we say this is important, everyone should be taking the HEI process and measurement seriously, that creates an environment that not only ensures we're going to do a good job today, but for future generations of caregivers, staff, and others, that we will one day put behind us the concept that there was ever discrimination or that there was ever an issue like this. We're not there today, but by being a leader in teaching, we can really make some progress in that area.